This clip is sponsored by American Mobile. If you're a nurse interested in traveling, visit americanmobile.com to get started.
I don't know, top five like stories about like med surg stories about wild people.
I mean, it's so hard to think about because like a lot of them are not necessarily like the most appropriate. But I remember this one patient I had who just was very eccentric. She'd like see people in her room. She was always yelling, screaming, always naked. But I remember we had a CF patient. So like, you know, younger, more physically functional.
She was a CF patient?
No. We had another one on the unit who was walking around the unit. And this one patient who was like, came in because she popped out the bushes. I think kids who were getting off the school bus or something like along those lines. It was very like disturbing. And then she came
Someone
out.
was like, that lady either needs to go to jail or the hospital.
Right. We're like, we're not really sure what is going on here. But she rolled out her tray table. She's totally naked, rolling out of her room with her tray. Because she walks, you know, she's pretty functional, just like her mind was. There's some crazy stuff going on in there. So she's naked, walking with her tray table out to the unit. We're like, oh, and then CF patient, poor thing, was walking by with her cute little husband. They were so sweet. And I was like, can you go the other way? I'm so sorry. We have like a situation. She's like so taken aback. Like for us, I feel like there's always nudity. Like everybody just for some reason gets confused and wants to take their clothes off. And it's like just a fascinating experience. And that same lady, she was with us a really long time. And like it was Christmas time and we took her out and she was sitting next to the tree because we had a little tree on our unit and she was singing Christmas carols.
Oh my God.
Or we'd have like other confused patients who would come out. We'd, you know, do morning huddle. And I was charged one day and one of the really confused, like pretty behavioral patients and his sitter were out in the hall walking. This was prior to COVID. But he's like participating in our morning huddle, just standing there with his sitter. I was like, and this is this patient, and this is, you know, because we have to talk about like behavioral issues. I'm like, and this is for right here. So have a great day. It's like that kind of stuff. Like these people, it's just so the things that run through people's minds is just so interesting and like. I don't know. It's kind of fun and cool. Like you would never know people like this. Like we see it all the time.
Well, and like you would never meet people like this because people don't function like this outside of the hospital. Like the only reasons that they are like so wild is because they have some acute thing going on that's inside the hospital. Like, so it's like we are this collective group of people that see the craziest bits of, you know, normal people, and we, you know, that's just part of the job. There's one, I remember one woman also like loved to walk around the unit. She was older, I think probably in her 70s, and she had like rapidly progressing Alzheimer's. I think it came on like fairly quickly, and so her family was still kind of starting to like cope with everything. It's like trying to like, you know, figure out what's going on. So they were very involved and responsive, and you could tell this woman was like a, you know, normal, you know, person before, maybe a couple of months before. And then I think she maybe got an infection on top of that. So she was just like all over the place and very behavioral for a while, and just like, you know, ornery. And but we got her, I think I had her kind of where she was like not combative, but just kind of just ornery. And I remember and very confused. And we were walking around the unit and somebody was like, oh, so-and-so, where are you off to? And she's like, we're going to get cigarettes. Bring your ass. And I was like, no, we're not. We're not doing that. We are just walking around the unit. Like,
that is hilarious. We're going to get cigarettes. Really? Okay, no.
Yeah.
That's the best.
People
or
say.
Like, I'm telling you, sometimes too, with like confused patients, you know, I'm sitting there with this detoxer one time and he's talking about go into the mailbox. He's got to like get out there, across the street, you know, right out there, talking about all sorts of random things he needs to be doing. So, you know, I'm texting the doctor. I don't have any PRNs available because it's clearly like a, you know, delusions. Like we're kind of hallucinating a little bit. There's a lot going on. Oh, he's talking all just out of his head. So crazy. And I called the doctor. I was like, hey, can you like come to the bedside? You know, it's important that you kind of see what I'm seeing because he's going to need some more Ativan. And he came to the bedside. And what is this patient talking? Oh, I'm in the hospital. When he's telling me he's at his house or he's at the post office. Oh, yeah, I'm in the hospital. It's, you know, whatever year it is, like totally functional. And I'm like, where did that come from when you've been acting up? Because I was on the night shift. So, of course, you know, it's a whole different ball game. So this doctor's like, why did you call me? I'm like, oh, this is like the one time and that he's been functional. Like maybe it's the, you know, you're wearing this white coat.
The
like
white coat.
He's like, oh, I need to like be on my best behavior. And he leaves and then he's talking about, the doctor leaves and we're talking about all crazy things again. I'm
like, take your coat off and come back in here.
I know. I'm like, please, I need you to see what I'm seeing.
Put some scrubs on with a little nursing badge and come back in here.
Right. I'm like, please. Because it is just wild. I'm like, how, you show him what you've been showing me. Like, that's what I need to see. Like, come on.
Yeah.